effect on human. Some people can still use them. However, it's not easy to use because there is a global understanding now that no one country will use these gases as a war. Certain organophosphorus compounds are nerve gases like soman, serine, tavun, BX. These are very trade name, and these are very very toxic, highly toxic. Even they just get touched in skin, people can die. This is very very toxic. In 1936, the German chemist Gerhard synthesized the neurotoxic agent tavun. Yes, he was the mastermind actually. A single droplet of sarin or VX, if inhaled or in contact with the skin, can be absorbed in the bloodstream and paralyze the nervous system. See, inhalation, there are different routes for the absorption of these neurotoxic substance or organophosphorus compounds. But even just touching with in contact of skin, it can penetrate the skin and absorb in the bloodstream and paralyze nervous system, leading to the respiratory failure and immediate death. See, these are really dangerous. And the VX is now banned by the Chemical Weapons Convention 1993. That means we have many international meetings and understanding that they are called convention. This is a language of law actually. There are many treaties, conventions, like sometimes you have seen it, Geneva Convention 1993, like that. These are some conventions. That means one kind of understanding between all the countries or many UN members countries. That's why it's not possible to use. However, people can misuse this. And compounds first used as an agricultural insecticide and later as a potential chemical warfare agent. That means these are actually discovered to protect our crops from the insect like nowadays. We see Salah just coming Nepal from our neighboring country, and farmers are trying to get it from in a different way. Some are saying to just make a loud music, they will escape. Some are saying no, we have to use some insecticide. Some are saying no, we have to cover our crops with net. It's a very difficult when they comes in mass. However, this is one possible things we can use, but it's a dangerous for user also. That's why it's not that much easy. They are normally esters with phosphate compound with some other chemicals like thiol esters or acetate derivatives or phosphorus containing acids. More than 100 organophosphate pesticides used worldwide. The majority are dimethyl phosphoryl or diethyl phosphoryl compounds. That means there are more than 100 types of these individual compounds are available in the market, and mostly they are dimethyl phosphoryl or diethyl phosphoryl compounds. Nerve gas compounds like tabun, serine, and so on are highly potent synthetic toxic agent of these groups. That means this tabun, serine, VX, these are very, very toxic compounds belong from these organophosphorus poisoning compounds. And common dimethyl and diethyl phosphoryl compounds are, there are in dimethyl organophosphorus substances and diethyl. See, we can see parathione, digenone, chlorpyrifos, dichlorpheranthine, comaphos. These are some dimethyl organophosphorus compounds. Here are diethyl, methylparathone, dichlorobos, dimethyl, melatonin, pheranthine. These are some compounds mostly available in the market. And these are some trade name available in the market. And I'm sure you have seen especially in agrovet shops or agro shops, they are selling some seeds as well as these insecticide chemicals they have. And the most commonly available brands in Nepal, these are generic name, and these are Metaseed, Parahid, Paradol, Nuban, DDVP, Nudan, Shuklor, Roger, Rogohid, Dermate, Dhanuban, Radar. These are different names which are easily available in the market, especially they are produced in India, and we are easily getting these in our market as well. But some drugs are banned in our country as well as in India. But in India, by hiding the government policy, they are still producing many these insecticide or pesticide substances. And the mechanism of action, see, this is the most important one. How a person get injury or how a person can die when we have exposure of this organophosphate poisoning. And I'm not going to explain very much. Just once understand very fundamental thing, then you will find yourself what is the other possibilities. See, organophosphorus compound, phosphonylate, the active side of the degrading enzyme acetylcholinesterase. If you remember this acetylcholinesterase enzyme, which ultimately destroy the acetylcholine in postsynaptic cleft. And we learned in the beginning of this blog that a neurotransmitter must be considered when there are some criteria. And one of that is they must destroy it wherever they are producing. And to the extraction of this acetylcholine, we have acetylcholinesterase enzyme. But what happened, these OP compounds bind with these enzymes, acetylcholinesterase, and ultimately that acetylcholinesterase is not available to destroy acetylcholine, and ultimately acetylcholine get accumulation. That is the very fundamental things leading to the accumulation of acetylcholine in the cholinergic synapses. That means we have acetylcholine. Normally we produce acetylcholine as a neurotransmitter, and to destroy that neurotransmitter acetylcholine, we have acetylcholinesterase enzyme. But these organophosphorus compounds, they bind with acetylcholinesterase enzyme, and now acetylcholinesterase enzyme is not available to destroy the acetylcholine. That means there is a accumulation of acetylcholine, and whatever we have information from presynaptic to postsynaptic membrane, that information will be continuously going on. What that means, suppose I have a defecation desire, that means I will continue have like diarrhea, something like that. That means whatever I get information, that will continue, and ultimately person will die. And there are some particular symptoms. 4 clinical syndromes have been described on the basis of their severity and duration of time. Acute cholinergic syndrome, that is the most common one. Once the person exposed with these organophosphorus poisoning. However, the severity depends on the quantity they used, the route they used, because sometimes if you inhale, maybe it's very dangerous compared to touching just any skin, or you just swallow it, or you get from this in the injection. There are many routes to for the absorption of these organophosphorus poisonings. But on the basis of different situations, we have classified in 4 classes. The cholinergic syndrome is the result of increased acetylcholine activity at the central and the peripheral muscarinic and the nicotinic receptor, and is potentially lethal. Yes. Cholinergic syndrome arises from either acetylcholinesterase enzyme inhibition or direct agonistic action at a muscarinic or nicotinic receptor. That means this is the most common one. There is an acute cholinergic syndrome. Whenever the patient get exposed or person get exposed with this, there are acute response, and that is due to that accumulation of acetylcholine neurotransmitter in the postsynaptic membrane. And some acute proximal weakness, that is intermediate syndrome. And the third one, organophosphate-induced delayed neuropathy. Third one, that sometimes also called organophosphate-induced delayed polyneuropathy. It's a rare delayed neurotoxic effect. That means suppose a person get exposed today, but symptoms are not being visible at the same time. It's not acute one. Maybe they have they will show these some effect after some days. Is a rare delayed neurotoxic effect which occurs 1 to 5 weeks after severe toxicity from some cholinesterase inhibitors. However, it is not thought to be due to the effect on acetylcholinesterase itself only. That means scientists believe that it's not only the involvement of acetylcholinesterase enzyme. Maybe there are some other reasons also, because that person who was exposed with these organophosphorus poisoning was showing these symptoms after 1 to 5 weeks. That means a quite long time. And chronic organophosphate-induced neuropsychiatric disorder. And the fourth one is the more chronic, and the chronic organophosphate-induced neuropsychiatric disorder is a rare condition following prolonged exposure to organophosphate compound. That means it is only mainly for those who are working with these organophosphorus compound, like suppose some people, some are farmer and they are all the time they are being exposed with these organophosphates because they are frequently using these insecticide or pesticides in their crops to protect their crops from the insect. And there is a risk of exposure because at least in a year they are growing 3 or 4 different types of crops, and to protect them they are at least 3 or 4 times in a year they are continuously being exposed, and there is a risk of some psychotic disorder when there is a prolonged exposure with these organophosphorus compounds. And acute cholinergic crisis, what happened, that is actually muscarinic effect. We know there are nicotinic and muscarinic receptors we already discussed that. And what happened in acute cholinergic crisis, that means what is the acute problem? The acute problem is cardiovascular problem, that is bradycardia, hypotension. That means bradycardia, actually pulse rates are generally less than 60 per minute for adult. However, it's vary for children and for elder people. But for adult, it's bradycardia when there is a pulse rate below 60 per minute, that is called bradycardia. And tachycardia when there is a more than 100 pulse in a minute, that is tachycardia. Hypotension, that means low blood pressure is there. And the respiratory system, also there is a rhinorrhea, that is runny nose and continuously mucus secreting from the nose. Bronchuria, more than 100 ml of mucus coming from the lungs. And the bronchospasm, that is a shrink of bronchus, a narrowness of bronchus, cough, severe respiratory distress. These are some acute condition or acute symptoms patient develop after exposure of these exposure with these organophosphorus poisoning. And similarly, GI tract, there is a hyper salivation, there is excess saliva, nausea and vomiting, abdominal pain, diarrhea, fecal inconsistency. This is a particular example. I told you that this accumulation of these neurotransmitters, especially acetylcholine, in the postsynaptic membrane, and whatever the information they get, they are continuously giving that same information again and again, because when they hand over their information, they must destroy it by the acetylcholinesterase enzyme. But there is no enzyme because that enzyme is occupied by these are organophosphorus compound. That's why this acetylcholine is not being destroyed. And the fecal inconsistency means incontinence means there is a suppose you have a defecation desire, but you can control some time. But when there is a exposure with organophosphorus compound, you cannot control defecation. You cannot control even single second. You cannot control. And the ocular, in the eyes, there is blurred vision. In gland, increased lacrimation, that is lacrimal gland in just the eye side. And there is lacrimation and excessive secretion of tears. These are some most common one, acute cholinergic crisis when a person exposed with organophosphorus poisoning. And nicotinic effect is muscle fasciculation or muscle twitch and cramping, weakness, diaphragmatic failure, hypertension, tachycardia, mydriasis, that is dilation of pupil, and pallor, that means looks like anemic or pale. These are another nicotinic effect. That means depends on where actually that organophosphorus poisoning affecting. Either it's a nicotinic receptor or it's a muscarinic receptor. That cholinergic receptor. It depends on where actually the problem. And similarly, we develop different types of symptoms. And CNS effect, anxiety, emotional liability, often accelerated change in mood, restlessness, confusion, ataxia, that is a poor coordination between these voluntary muscles, tremors, seizure, and coma. These are the effect in central nervous system with the exposure of these organophosphorus poisoning. And then intermediate syndrome, those previously we learned they are actually acute symptoms, and now we are intermediate. That means neither very long, prolonged, nor very acute. It only occurs 24 to 96 hours after the ingestion of an organophosphorus compound. An initial cholinergic crisis, but before the expected onset of delayed polyneuropathy. That means it's after the acute phase, but before that delayed one. That's why we are saying intermediate, in between. And approximately 10 to 40% of patients treated for acute poisoning develop this illness. That means suppose there are some patients having some acute cholinergic crisis and they just come in the emergency doctor treat whatever the possible antidote is available, and then after 1 day or 1 to 5 days, 3 days in between, patient develops secondary or other symptoms that is called actually intermediate symptoms. Sometimes we see that patient within 12 or within 24 hours, doctor said, no, patient is stable. But sometimes after that, patient get again violent or more deteriorate. That means that there is a possibility of intermediate syndromes, and characterized by prominent weakness of neck flexor muscles or respiration and proximal limb muscles. These are the other possibilities where patient get a weakness in the neck flexor muscles of respiration and the proximal limb muscles. Mostly seen with phenanthione, dimethoate, and the monocorphoate. These are the some organophosphorus poisoning when they are exposed to any person. Mostly they show this kind of symptoms called intermediate syndromes. And muscle weakness may last up to 5 to 14 days. That means maybe these muscle weakness up to the 14 days or that is up to 2 weeks. Condition regress slowly if respiratory support is available. That means it may be restored if the we have a facility for artificial respiration or ventilator or ICU setup. We can do that. If there is not availability of these setups, there is a risk of dying patient because of that respiratory failure. And exact pathogenesis is unclear. Yes, we don't know why this happens actually. The proposed mechanism includes persistent inhibition of this acetylcholinesterase, leading to the functional paralysis of neuromuscular transmission, muscle necrosis, and oxidative free radical damage to the receptors. That means, however, there are some proposed theories which are neither neglected or neither completely accepted, but they are proposed and still research is going on. There is persistent inhibition of this acetylcholinesterase, leading to the functional paralysis of neuromuscular junction. That means, suppose sometimes we are unable to get the information, whatever we have, and we get information, but continuously we get, and finally our nerve system get failure because of that. We have to destroy that acetylcholine and neurotransmitter with the help of acetylcholine. But we don't have that because organophosphorus compounds are attached with the enzyme. That time this nerve system get failure, and that failure seems like that functional failure actually. And these neuromuscular transmission, muscle necrosis, and oxidative free radical damage to the receptor. That means when that happens, there is a chances of development of free radicals. These are free radicals or charged particles, which are really very danger, and they are free, and they have a charge, and they easily bind with other charged particle, and they destroy our cellular system, cell membranes. There are many free radicals. That's why we use nowadays antioxidant. It's very common nowadays. People say, hey, it is a good, green tea is good because it has an antioxidant or something like that. That means these antioxidants bind with these free radicals and they neutralize them. That's why antioxidants are good. And when there is a continuous exposure of this acetylcholine, continuous accumulation of these neurotransmitters, especially acetylcholine, there is a risk of development of these free radicals, which ultimately damage the nervous system. And third one, delayed polyneuropathy is an uncommon consequence of severe intoxication or intermittent and chronic contact with organophosphorus pesticides and occupational exposure. That means occupational, as I told you, the farmers especially, they are exposed, or sometimes not farmer only, those people who are selling these in the shop, and they are not taking universal precaution, that time there is a risk of exposure with those who are selling, who are transporting, who are working on the production factories. There is high risk because that is professional or occupational exposure. It is due to the inhibition of neuropathy target esterase enzyme in the nervous tissue by certain organophosphorus compound, yes, often unrecognized in human. That means it's not easily detected in the beginning. Distal symmetric sensory motor polyneuropathy, distal weakness, ataxia, diminished or absent reflexes, these are the common symptoms present in patient or person. Symptoms usually begin 2 to 5 weeks after exposure and may last for years. That means 2 to 5 weeks, but it depends on how concentrated organophosphorus poisoning was the exposure with that person, or how long, because duration also matters. Suppose a person working with these organophosphorus compounds from morning to the evening and continuously, that means more exposure is there. Or a person just exposed for a half an hour. That's why it depends on. And the symptoms are maybe after seen in 2 to 5 weeks. OP pesticides can also cause chronic neurotoxicity and behavioral impairment in some patients. Yes, there is a risk of neurotoxicity and a behavioral change in some workers or this occupational exposure. And cause of death in organophosphate compound poisoning. Yes, now we have to know why people die. And dying is acute condition. We know that there is a respiratory failure, there is a cardiac failure, there is a multi-organ failure. In intermediate death, there is seizure, complex ventricular arrhythmia, abnormal rapid heart arrhythmia that originates in the lower chamber of the heart and the ventricles. This is one cause. Death within a 24-hour acute coronary crisis in untreated or severe case, respiratory failure, I told you. Death within 10 days poisoning, intermediate syndromes, that is the reason, because there is a functional damage of the nervous system. And death within 10 days of poisoning, intermediate syndrome, again same. Late death, that is a secondary to ventricular arrhythmia, include Torsades, D-points, specific form of polymorphic nerve tachycardia in patient with long QT interval in the ECG, especially when we do ECG, there is a elevated segment of key T segments intervals in ECG, which may occur in up to 15 days after acute intoxication. That means that is another possibility of late death, even after 10 days or 15 days. Sometimes we hear that one patient has swallowed 250 ml of methadone, and he was kept in ICU for 10 days, and after 10 days he died. And we blame that, these hospitals are almost like terrorists. They just need money, nothing else. And they are just putting a patient into ICU and saying it's still viable, but patient was dying in the first day or second day. They just want to earn money. That's why they are saying patient is live in the ICU. But actually, people assume that. Yes, there are some fact that sometimes some hospitals have done that for some sake of money. They have misconduct or unethical practice they have done, but it doesn't mean that all do that. There are some possible reason, especially in these organophosphorus poisoning cases. Patients are viable, but they may die after 10 or 15 days. Yes, this much for this today, and hope you learn something about organophosphorus poisoning. And for this, you have to again revise that neurotransmitter, because you have to know what is the function of acetylcholine, how it acts, what is the destroying enzyme, like that. Once you have a very fundamental knowledge of these neurotransmitters, it's very, very easy. Thank you very much for listening. And this time, this ANS-MS committee almost finished. And if you have some problem or you want to learn something more, you can email me anytime, and I'm happy to answer you so far. के छ सोध्नु पर्ने? छलफल गर्नुपर्ने भोलि अब भोलि हैन from next time you may have a next block and I'm not sure what is the next block. Let me check. Semester 1
cardiovascular.
Oh, cardiovascular to semester 2 मा छ
अनि semester 1 सक्यो त सर अब पेपर 2
semester 1 सक्यो है त्यसपछि त एक्जाम हुनुपर्छ अब यस सेमेस्टर 1 सक्यो सेमेस्टर 2 मा हाम्रो कार्डियोभास्कुलर हो नि त्योभन्दा पहिला हिमोपोएटिक रेस्पिरेटरी र कार्डियो तीनटा छ ठीक छ कार्डियो चाहिँ मै पढाउँछु होला हिमोपोएटिक रेस्पिरेटरी कसले पढाउनुहुन्छ लेट्स सी ठीक छ next one is I think we will have some practical as well through the Zoom and I'm not sure but informally I'm saying to I will happy to share you maybe we have an exam or some assignment very soon with you with some Moodle system we have that is Moodle is one application where you can log in and the teacher will give you some assignment, teacher give you some notes, you can read and you can submit your answer by looking in textbook or by just MCQ within 1 minute, something like that, because we are learning that application now and once we learn I think then you will give some assignment. You will get some assignment and you have to submit regularly, not assignment only, you will get many other things as well. And hopefully this corona I'm not sure it will stop. I don't think it will stop, but we have to start fighting with this and maybe after our that national festival Dasai or Tihar we will resume our regular session and we will have our traditional system to teach and learn and teach, but I'm not sure, it's just informal, it's not formal. Anyway, don't stop learning because whatever we have opportunity to learn, just grab that. Whatever it is online or offline or face-to-face or synchronous, asynchronous studies, whatever is this, we have to catch the opportunity as much as we can. Okay, so this is हजुर
सर त्यो ओपीसी पोइजनिङबाट त्यो ब्लड भेसल्सहरु रप्चर हुने चान्स हुन्छ
डिपेन्ड्स ब्लड भेसल ठ्याक्कै त्यसैले रप्चर त हुँदैन हैन तर अब जसरी किनभने तिनीहरु धेरै जसो एसिडिक फर्ममा छन् हैन अब कुनै एउटा भनौं न एउटा मान्छेले रिस उठेर घरका मान्छेलाई रिस उठ्यो भनेर घरमा राखेको मेट्रियन 250 ml को खाइदियो खाँदाखेरि त अब त्यो त आफै एसिड हो हैन अब जहाँ त्यसले टच गर्छ त्यो एरिया नै डिस्ट्रोय गर्ने जस्तो हुन्छ त्यहाँनिरका ब्लड भेसल रप्चर हुने चान्स धेरै छन् तर अब कार्डियक सिस्टममा जसरी त्यसले नेक्रोसिस गराइदियो अथवा पल्स रेट धेरै बढाइदियो अथवा पल्स रेट घटाइदिएर ब्लड प्रेसर घटाइदियो ब्लड सप्लाई नहुने बित्तिकै ब्लड प्रेसर रप्चर हुने चान्स बढी छ त्यसरी चाहिँ हुन सक्छ तर डाइरेक्टली अब यसरी नै हो भन्नु चाहिँ भन्नु मिल्दैन डिपेन्ड गर्छ कति सिभियर छ जसरी मेन्स्ट्रुअल साइकलमा ब्लड भेसलहरु रप्चर हुन्छन् नि ब्लड भेसल रप्चर हुन्छन् मेन्स्ट्रुअल साइकल सुरु हुन्छ हैन मेन्स्ट्रुअल फेज सुरु हुन्छ भएपछि त्यो किसिमको नेक्रोसिस हो नि त किन नेक्रोसिस भयो अल अफ सडन त्यहाँ हर्मोनहरु पज हुन्छन् जसले गर्दा त्यहाँ ब्लड सप्लाई रोकिन्छ अनि तिनीहरु रोकिने बित्तिकै के भयो त्यो एरियाको ब्लड सप्लाई रोकिने बित्तिकै ब्लड भेसलहरु रप्चर हुन थाल्छ त त्यस्तो किसिमको सिचुएसन चाहिँ आउन सक्छ हैन तर ठ्याक्कै बिरामी मर्ने कारण त्यो भन्दा पनि बढी त्यो कार्डियक फेलियर रेस्पिरेटरी फेलियरमा बढी चान्स हुन्छ हैन अब ब्लड भेसल रप्चरै हुने केस पनि हुन सक्छ तर अब 100 किसिमका छन् हैन कसमा के चीज कस्तो किसिमको एड गरेको छ थाहा छैन त्यही भएर प्राय तपाईले सुन्नु भयो होला फुड पोइजनिङको के रे यो अर्गानोफस्फोरस पोइजनिङको बिरामीलाई के खाएको थियो बिरामीले त्यो लिएर आउनुस् भन्छ डाक्टरले सबभन्दा पहिले त्यो चीज ल्याउनुस् किनभने त्यसमा के थियो त्यो हेरेर खोज्छ अनि त्यो अनुसारको ट्रिटमेन्ट गर्न सजिलो हुन्छ किनभने त्यही अनुसारको एन्टिडोट दिनुपर्छ हामीले हैन अब एट्रोपिन सबैभन्दा कमन हो एन्टिडोटमा चलाउने तर अब डिपेन्ड गर्छ त्यसमा के कम्पाउन्ड छ त्यसलाई केले न्युट्रलाइज गर्ने हो हैन त्यो थाहा पायो भने सजिलो हुन्छ भनेर त्यही भएर सकेसम्म त्यसले के खाएको थियो लिएर आउनुस् भनेको हुन्छ बिरामीलाई कारण चाहिँ त्यो
थ्यांक यू सर
अरु केही छ
सर यो स्लाइड पनि पठाइदिनु होला सर
हुन्छ म पठाइदिन्छु
हस्
हुन्छ अरु केही छ
सर
हजुर
यो हैन जस्तै यो अर्गानोफस्फेट हैन मतलब सर्टेन अमाउन्टमा त्यो हुन्छ कि मतलब जति खाए पनि त्यो त्यस्तो मतलब रियाक्ट गर्छ बडीमा जस्तै थोरै अमाउन्ट गयो भने चाहिँ जस्तै कुनै कुरामा कन्टामिनेटेड छ हैन अलिकति पनि कन्टामिनेटेड छ भने हैन अनि त्यही मतलब त्यही हिसाबको नि त्यो गर्छ यस्तो डिफेक्ट गर्छ कि कम त्योभन्दा कम गर्छ
हैन कस्तो हुन्छ भने नि इफेक्ट गर्ने फ्याक्टरहरू के हुन्छन् भनेर बुझ्नुपर्छ हामीले सबैभन्दा ठुलो फ्याक्टर त कन्सन्ट्रेसन हो कति कन्सन्ट्रेसनको हामीलाई एक्सपोजर भयो भने चाहिँ अब तपाईले कन्टामिनेट भएको भनेको अर्थ हो त्यो डाइल्युटेड भयो काहीँ न काहीँ पछि तपाईको रिस्क अलिकति घट्यो तपाईले प्योर फर्ममा नपाए त्यो केसँग मिसिएर गल्तीले खानु भयो भने त्यहाँ त रिस्क घट्यो नि त किनभने कन्सन्ट्रेसन घट्यो नि त त्यसको त्यही भएर त्यसको कन्सन्ट्रेसन कति थियो त्यसको भोल्युम कति थियो कुन रुटबाट एक्सपोजर भयो यी चिज 3-4 वटा कुराहरूले डिसाइड गर्छ अब जसरी मैले सुँग्नु एउटा मैले अर्गानोफस्फोरस पोइजनिङ मसँग छ मैले सुँगे मात्रै अर्को बिरामी त्यसलाई पुरै खायो भने चाहिँ त्यसलाई बढी रिस्क छ नि त मैले सुँग्दाखेरि अलिकति मात्रै गयो होला पुरै खानु त झन् खतरनाक भयो त हैन अथवा अर्कोले खायो तर डाइल्युसन गरेर खायो उसमा अनि यतिले म मर्दैन भनेर त्यसमा अझै पानी मिसाएर धेरै हुन्छ भनेर उले त्यस्तो सोचेर खायो भने त्यहाँ डाइल्युसन भयो हुन त अब भोल्युम त यति नै जाने हो तर एकछिनलाई टक्सिसिटीको लेभल डाइल्युट भएर जाँदा हुँदा एकैचोटि र्यापिडली जुन जानु पर्थ्यो त्यो घट्यो त्यही भएर डिपेन्ड गर्छ हामीले कुन रुटबाट लियौं कति कन्सन्ट्रेसन लियौं कति अमाउन्टमा लियौं बुझ्नु भयो कुरो
यस सर थ्यांक यू सर
ठीक छ अझै कुन रुट विभिन्न किसिमका रुटहरू एब्जर्प्सनका रुटहरू छन् अब हामीले त भन्यौ स्किनमा टच भए पनि एब्जर्ब हुने रिस्क खालका पनि छन् ग्यासहरू त हैन हैन अब कुनै इनहेलेसन मात्रै गर्यो हैन कसैले खाइले दियो कसैले होइन म खाएर पनि मर्नेवाला छैन भनेर सिरिन्जमा लोड गरेर आइबी नै हान्दियो भने त त्यसै मर्छ मान्छे हैन त्यही भएर इट डिपेन्ड्स अरु के छ अरु केही छ अरु केही छैन भने अहिलेलाई हामी छुट्टिन्छौं हैव अ नाइस डे स्टे सेफ
थ्यांक यू सर